Heart disease remains the number one killer in the US and around the world.
We're seeing patients that are sicker and are more complicated.
Both because people are living longer, but also just with lifestyle choices.
Our approach is to provide holistic cardiovascular care for our patients. So as soon as a patient enters our doors, they know that we can take care of it all, and that's the advantage of having a cardiovascular service line where all those skills are under one roof.
I always say we are small, but we are mighty. It really starts with our front desk. If my clinic team's available, they will bring a patient into the room, answer the questions they may have. If they do need some type of follow-up, we get them then to our schedulers.
We do a lot of outpatient care. We also take care of inpatients who come in having chest pain or heart rhythm issues. We say time is muscle, because if someone's having a heart attack and there's a blockage, that is heart muscle that's not getting oxygen. So every minute that it's being starved of blood, the muscle is getting weaker and dying.
In the late 80s, 90s, early 2000s, someone with 3 vessel blockages, we would offer them a triple bypass operation. That's not the case anymore.
So it's a lot of moving parts between the ER staff, EMS, paramedics diagnosing it, getting us called in, getting them up to the cath lab, and then diagnose the problem, fix it with a stent.
Atrial fibrillation is estimated to affect up to 1/3 of people over the course of their lives. It's become probably one of the most common conditions that cardiologists treat. You can, in many cases, fix these problems with procedures like a catheter ablation, where we can go up and find the short circuits that cause these abnormal heart rhythms.
We tend to use radiofrequency more often compared to cryotherapy, so it's a heat therapy versus a freezing therapy. And so they're essentially laying down scarring to help eliminate that arrhythmia.
Technology continues to evolve, so less and less patients are going to be asked or being offered at least the invasive approach.
New procedures and learning about new procedures is exhilarating, and it's a lot of fun. I think the most rewarding thing is seeing the difference that you can make for somebody.
Like I like to tell my patients is that we want you to be better than you were before surgery. Now, sometimes that takes some time, and rehab after surgery will help with that.
When they are discharging from the hospital, we really try to get them scheduled for their initial cardiac rehab appointment to make sure there is not that gap in their care.
Cardiac rehab is very important. It gets them into a safe environment where their blood pressures, heart rates, and heart rhythms can be monitored, and it allows them to feel safe in terms of pushing themselves.
So that they have the confidence that their heart rate, rhythm, blood pressure is looking normal in cardiac rehab when I do this level of work. So if I go home and do that level of work, everything's okay.
There's a lot of cooperation and collaboration among different groups within the North umbrella.
I don't hesitate to just stop one of my colleagues, talk to them about a patient in the hallway, and again, it's a very personal approach, I think, to taking care of our patients.
What sets our program apart is the unwavering commitment and engagement to the community.
If not for North Memorial, who is going to stand in the gap for these patients? Patients that come to this institution, we know 70% of them are either underinsured or uninsured. We can't turn our back on those patients.
Whether you have insurance, what kind of insurance, none of it matters. We want to take care of you, we want to help you and make sure you leave here better than when you came.
Vince DeMont knew this back in 1954 when this hospital came online. We serve the community, we serve these patients.
You know, we're doing essential work, but there's a lot of potential for us to do more, to grow, to take care of more patients, to do new procedures.
North Memorial must continue to be strong for this community. And where it is a badge of honor that you get to serve people that are so underserved and sometimes neglected.
It's hard to overstate how much of a difference your support and your presence is making for our teams, and in a very direct manner, helping our community and our patients. You're directly helping to eradicate cardiovascular disease from our community and helping the people in this area live better lives. So thank you very much and have a great night.